the Medical Practitioners Organization is blaming the health department for the thousands of medical graduates who have still not been placed. Over 1,000 unemployed medical doctors marched in Pretoria yesterday. They're demanding jobs that are desperately needed in the country's public health facilities. Let's get some perspective now, and we'll speak to Dr Percy Mahlathi, Deputy Director General in the National Health Department. Dr Mahlathi, good morning to you and thank you for your time. You have heard the complaint from a medical practitioners organization which basically blames your department for what they say is you are failing medical graduates in the country when the system desperately needs them.
Well, good morning, Xoli, and good morning to your viewers. I think the first I would like to say is that it is very unfortunate that when we have the ability to engage on issues, a professional organization runs to the media before really complying with the requests that have been made. Let me just summarize. About a week before Christmas last year, SAMATO raised the issue of doctors who would potentially be unemployed after finishing community service. They sent us a list of 286. I have it in front of me. We then wrote back to them and said, colleagues, please give us a proper list, full name and surname, their contact numbers, and at least the HPCSA registration number. But that list came just with names only, no contact number, no registration number. Our intention was to then take that list and actually request our provinces to then make a comparison, because those who are bursary holders who should automatically, serve back, their study time by working. But unfortunately, that did not work out. Then in January, around about mid-January, there was an allegation that is 400. Now, I heard yesterday morning the secretary of SAMATO on SAFM saying it's 1,000 doctors. Unfortunately, we don't have a list of 400. We don't have a list of 1,000. All I can say is that of the 2,000, about 2,546 community service doctors that we had last year, already 1,565 are in their jobs. 464 are being finalized. But you need to know that not every doctor who completes community service wants to be employed by government. Some people want to take a gap year, travel across the world. Others go and do locals in the private sector. Others go and set up their own practices. So we cannot say simply because we're 2,546 community service doctors, all those will be employed. However, there are areas where we vastly agree with SAMATO on that our health system is underfunded. And as the health department, we don't fund ourselves. We get allocations from Treasury. Treasury that must actually cut the cake delicately to fund all the sectors, education, social development, health, and so on and so on. So it's not without lack of trying to get funded more so that you can employ. And I would repeat and say, you cannot employ somebody in your household and afterwards you say, I'm sorry, I don't have money to pay you, but I've employed you. So we actually have to be very careful because these are public resources, they're not personal resources. And also we need to be very clear that we don't play around with the emotions of young people that are starting their careers.
Yeah. You've said quite a mouthful there, Dr. Mahlathi. I'm going to sift listening with a journalistic ear. Yes. On the one hand, you are talking about SAMATO not being straight with you in a way that you are talking to them, but they are running to the media. You say you've requested that there be names and the registration numbers of these students who are now certified as doctors, but that would obviously fall in the domain of the Health Practitioners Council. Is there a communication breakdown here? You would say that they've decided to take this step of going public with what they are unhappy about?
Well, I don't think there is communication breakdown. You must remember that a union, and sometimes what gets put forward is not necessarily what is all the driving force behind it. All that we're concerned with is that if Samato comes and says these are our members, certainly they've got details about their members. And we're asking not, private personal information. We're actually saying give us it so that when we then give the number to Limpopo, to Northwest, Eastern Cape, Western Cape, we would have checked with the Health Professions Council that these are people that are duly registered.
Yeah.
We've had situations before where people have actually come up and said they are doctors. When we check with the HPCSA, they are not registered. So we must take responsibility also to protect the public so that whatever information that we put forward is information that we're verified and we're clear that it is correct. And by the way, the memorandum that they submitted yesterday is no longer just about the employment of doctors. It's veering to many other issues that have not been raised with us before, but are being aired in public. I don't think it's a communication issue because Samato knows exactly who it engages with in department. They've engaged with the colleague. Even the day before yesterday, they were engaging with him. So that is why I'm saying I don't think necessarily it's a matter of communication.
What's the way forward then?
Well, they've submitted the memorandum which the minister acknowledged. They're raising basically 4 issues. One of the issues will require that there be detailed engagement with the Department of Public Service and Administration. The other one has to do with treasure. The other one is an academic issue about the training of registrars in the country. I'm sure it's the first time you hear about that coming from them. Of course, the other one is about, the employment, a process that is going on. Yesterday, we checked with the provinces, and Limpopo especially said, we advertise post, there is no applications for the rural facilities, that rural hospitals that they have actually advertised.
Right.
Now, when then people come up and say, look, doctors are not being employed, but you've got a province that says we've got positions here and people don't want, in fact, they decline offers to actually be allocated there. There is a problem. So what we're hoping for is that the heads are going to cool down. We will sit down and approach things the way they should have been approached right at the beginning.
All right. Percy Mahlathi, Dr. Percy Mahlathi, Deputy Director General in the National Department of Health Department.